fantastic. Then we can just chat whatever we want. I know so many people were very excited. They're like, oh, I want to meet her and find out, like talk about stuff. But whether they can break away from their work, you know, who knows?
So which is fine. And I mean, I'm happy to do this again. If you know, there's enough interest and stuff, you know, I love talking about stuff. Dance is my passion. That's why I got into physical therapy. So I can talk about this all day, every day.
Fantastic. I love it. I can talk about it too. And
Yeah.
I know that it's like, it's one of those things like I forwarded you a few questions that were from me because like,
Mhm.
well, if nobody is here to talk, I've got some questions.
Oh no, that's okay. We can dive into those things. So do
Cool.
you wanna wait for a couple of minutes before we
Yeah,
unmute?
why don't we do that? Why don't we
Okay,
do that and see if
fine.
anybody else comes?
Yes.
I see Samantha is here and she can be muted or not muted, people, whatever they choose to do. So I've never, um, you know, I know that some of these things can get pretty big, but you know,
This is
um,
the second webinar I'm doing today, so
oh my gosh, you did another one?
yeah, today's a busy day. So I was helping a colleague of mine since COVID-19 is now this big crazy thing that's kind of uprooted a lot of our lives. Most practitioners, most medical practitioners are not practicing in the clinic. A lot of them are not, including myself. I've closed my clinic for at least a month now. So a lot of people are now doing telehealth or telemedicine. But the interesting thing about it, I've been doing it for quite a few years. It's not new to me, but it is still new to not only a lot of clinicians, but to a lot of patients. They're just like, how are you treating someone if you can't see them? Like, a lot of people are having a lot of difficulty wrapping your brain around it.
Yeah.
So I was helping a PT friend of mine do a webinar where she talks about and educates clinicians, practitioners about telemedicine, how to get into it, how to set it up in your clinic, how, you know, just the how and the nuts and bolts of how it works. And there's just a lot of interest in that right now. It's a very hot topic in the medical world. So yeah. So I've
Yeah.
been talking for a while, but it's
Yeah,
okay.
well, let's just get started then. Why not? We're recording this, and then people can we can upload this to. I mean, that was another thing too. It's like it is uploaded, so we'll put it somewhere so that people can hear all of your wonderful words of wisdom, and Daniela and me and whoever else asking questions.
No worries, no worries.
So first of all, your background. Now, you and I just happened to meet in a ballet chat forum type thing.
Yep.
And your background though is tremendous. And I
Thank you.
love, you know, so, and of course I love hearing that ballet or dance is somebody's passion. So what is your dance background?
Sure. So I started dancing at 3, very, very long time ago. I won't betray my age. But I started dancing at 3. I'm trained in classical ballet and modern. I did the RAD, so Royal Academy of Dancing syllabus. The accent that you hear if you do detect one, I'm originally from Trinidad and Tobago. So that's where I did the bulk of my training with the RAD syllabus. When I came up here when I was 21 for college, I did a little bit of dancing. Outside of college. So I did like scholarships in New York with, who did I dance with? Ballet Hispanico, Albanelli, American Dance Theater. After college, I did a small stint with a small modern dance company in the Lower East Side of New York. And then after physical therapy school, and I moved down to the DC area, I've just kind of been dancing in and out. When you're working, it's very difficult, as you probably know,
Yeah.
to devote the time and that you can or that you had before in terms of dancing. So that was probably the last time that I danced seriously when I was in New York. But I've been dancing forever, for as long
Yeah.
as I can remember, you know, doing lots of performances. So yeah, that's kind of my dance background. I've had the opportunity to work with a lot of amazing professionals in the dance world when I was a dancer. And funny enough, you know, as my career developed in terms of physical therapy, I was able to just merge those two worlds, which was completely a blessing for me. I wanted to get into medicine. My background in terms of how I got into physical therapy while I was at Alvin Ailey, American Dance Theater, during a summer intensive. I was there for a scholarship. I literally got off the floor and pulled my groin. It was the weirdest injury ever. And by the end of the day, by the time I got home, I was like bent over and I couldn't walk. I didn't know anything about my body. You know, so my boyfriend at the time was like, you should put some ice in it. I was like, you're crazy. That's not happening. I'm not doing that. And I put heat on it and made it completely worse. So, you know, it was just sheer panic of being on a scholarship and not being able to move. And I'm just like, what do I do? And I sought out a dance physical therapist there, and she magically fixed me. And I'm like, that's what I'm doing with my career.
That's
So
amazing.
it was a perfect match of being in medicine and not having the intense schedule of being on call as a physician and that sort of stuff. Because I do like to travel, I do like to spend time with my patients. I wasn't very much into the 5 minutes with a patient kind of thing. That's not the rapport that I wanted with medicine in terms of my interest with it. But being able to serve dancers, which was very close to my world and the people that I love, was just a perfect match. So that's how I ended up in physical therapy.
That's fantastic. Yeah, it does seem like it's like I think that if you have that background, every time that you're seeing a dancer, you know immediately, okay, this is the injury, this is what they need to do. And like so many doctors that a lot of dancers see, they think, well, you can walk, that's fine. You know, it's like, okay, but I need to bring my leg up here, or you know, it's like down here. So you as a dancer, as a form, you know,
Mhm.
dancing as well, so you know, okay, it's not just that you need to be able to walk, you need to,
Yeah,
you know, so
absolutely. And
yeah.
I have lots of strong opinions that I will not go down the rabbit hole why that is.
I want to
But
hear strong
yes.
opinions. I want to hear
Well,
strong.
it's interesting, you know, in the past couple of years, I've started to, you know, when you start seeing enough data points, you start making conclusions. I've been practicing for 15, going on 16 years now. I've been seeing dancers for 15 plus years. And being a dancer, I do believe that there are two overarching things that dictate why dancers get injuries and why they get the medical treatment that they do. Number one is that dancers, in terms of our culture, we are taught to accept pain. We are taught to ignore pain. Yeah. So if you've not heard it, no pain, no gain. Somebody has said that to you at some point in time. Somebody has said, oh, it hurts. It's supposed to hurt. That's fine. So our pain perception has changed. The way that we interpret those pain signals when you are injured or changed. And therefore our ability to detect when we're actually injured and get ahead of it is completely changed. That's within the culture of ballet, very much ballet specifically, but in the dance world, it's very much in our culture. We don't complain, we don't talk about pain, we don't talk about injuries. It's the kiss of death. If you talk about it, you're gonna get taken out of your place, you're gonna lose your spot, you're not gonna be able to perform. So you do whatever it takes in order not to get there. I've seen this in as young as 7-year-old dancers who have told me, I know Susie said that her back was hurting her, but she didn't say anything.
Mm,
That young, that's when we learn how to do this. So it's very much a thing that we have to start slowly unwinding because we don't realize how much of a detriment down the line it becomes. And for you guys, as you become adult dancers, you start realizing, oh yeah, that thing I didn't take care of when I was 6, now I can't do anything at all. That's the consequence of it. So that's number one. Number two, because the world and also dancers ourselves, we don't view ourselves as athletes. We get treated different. The value in what we bring to the world in terms of the time that we put in, the hard work, all of the things that we have to do to produce a show or to produce movement for someone else's enjoyment is really diminished when we do not regard ourselves as athletes. And the fact of the matter is that we are doing athletic work.
mm,
That's a fact. You look at the research, you look at any sort of comparison in terms of aerobic expenditure, muscle performance, everything, we are in the same exact category. But because we do not consider ourselves athletes, because we are very much wrapped up in the artistic side of it, not only does, in my mind, the audience, which is, you know, the people that pay us, not regard us as, oh, they're just twirling around, they're just dancing. The medical world now starts getting that feedback of, oh, well, you don't have to get your leg here, just walk, you're walking, you're fine. You can do what everyone else does, and that's fine. I will frequently hear dancers come to me and it's like, I went to my doctor and I told him, and he was just like, well, just don't do that.
yeah.
It happens all the time. And I'm like, you heard that before. Happens all the time. all the time. So until we start regarding ourselves as athletes, until the rest of the world starts recognizing the difficulty that it takes in order for us to do what we do, then we're not going to start getting the access to information, the access to services that other athletes get. If you look at any college program, you look at the dance program, you look at the athletic program, the resources are completely different. And in many of the schools that I've been to, the dance department cannot have access to what athletes have because it's not for them. They are not athletes. Do you see what I mean?
Yeah, but that's funny because as soon as you said, oh, we're athletes, my mind went, oh no, not an athlete, artist. Like that was my first thought, was like, because it's ingrained in my mind too. I'm thinking, no, we're artists, we're creative individuals. But so if I'm something like I live dance, and if I'm thinking that, by the dance world, people are thinking,
Of course. And so when and I'm not saying that that's particularly wrong. I think what needs to change, like, keep the artistry. That's what makes us special. That's what makes us different. But what you need to acknowledge is that your body is your template. It's how you express your artistry. If you don't take care of this, you have no art. That's it. You know, a painter has a paintbrush and a canvas. You know what I mean? A musician has their instrument. Your body's your instrument. Without it, you don't have an ability to express what you have. And the way that we do that is by training. There's a reason why we got to be in class 6 days a week. There's a reason for that. Okay? Repetition over time, muscle memory, learning motor control plans, and all of these things is the way that we express our art. So we are doing athletic things to get across the artistic expression. If we don't merge those two and acknowledge how important the athletic side of it is, we lose a lot of the things and the recognition that other athletes kind of get. And the third thing, I promise I won't get too passionate about this because I can talk about this for like 10 million years. But the other reason, and this is a theory, this is take this with a grain of salt. I think a lot of the reason why medical professionals treat dancers the way that they do is because it's mainly a female sport. I do believe that. And I say that because over my practice and my career, I have seen, and I'm in the orthopedic world, which is largely male, very much male, older male oriented. I have seen numerous times the way that female patients get treated compared to male patients. And I'm not even talking about athletes. I'm talking just the differences between sexes. And I started to really start paying attention to, why would this doctor just dismiss, oh, you're in pain after 6 months? You must be depressed. Let me give you some medication, without even touching a patient.
Yeah.
This is the sort of thing that we have. So imagine when a super thin, lithe, beautiful dancer comes in and they're like, well, doctor, I have pain when I bend back, and they fold themselves in half, which 95% of the population can't do. The man thinks she's crazy and she should just relax. That's why.
Yeah. Yeah.
And again, empirical evidence, just observation. This is not in any sort of journal that you'll see anywhere. One day, later on in my career, I'm going to actually start testing this because I believe it's a thing. But all of these things kind of start converging to give you why dancers have the experiences that they do, and you even start going down the road of how we're compensated for our art and our craft. Look at the performing artists across the board. We are the only ones who have not figured out how to be compensated for our skill.
Yeah.
Think about it.
Yeah.
Okay. Singers, writers, playwrights, actors, they figured it out. We have not figured it out. Yeah. We're still like, oh, well, I should just, I should rehearse for, it's free. It's just exposure.
Yeah. Yeah. Oh, absolutely.
Yeah.
Look at the situation that we're in right now with this pandemic. What is out there online? What is it? It's free art, right? Yeah. We are there's dance everywhere, which is wonderful, but people are just like, oh, here, you're sitting at home. Look at my beautiful art. And here's this for free, and this for free, and this for free. Where are the athletes? The athletes are, back at home. I'm sure they would like to be performed, like they're doing their thing as well, but they get paid millions of dollars, right? And we're just throwing all of our stuff out there. Please feel better. We want you to feel better. It's like, they look to art as something to soothe their soul and in troubled times, and yet they feel no compunction to to finance that.
To pay for that. Exactly.
Yep.
Exactly. What is the first thing that people in Italy started doing when this thing broke out? People were on their balconies singing and talking to each other, playing the violin.
Yeah.
And this one was playing this, and people were, there was a dance class that was being held remotely. The first thing that people go to is the arts, but we don't value ourselves enough to put ourselves out there and say, you should pay for this.
Yeah.
Well, if we don't say it, then who is going to fight for us?
Yeah, and then, exactly, and that's going to go right into our physical well-being and not seeking professional help whenever we need it,
Of course. And there is a little bit of a revolving door. This is something that I tell all of my dancers, and they give me this look like, oh, I'm like, think about it. When LeBron shows up for practice, do you think he's getting paid? Yeah. I don't follow basketball, by the way, but I'm just saying, like, does he get paid? Yes. If he shows up, he's getting paid. You know what I mean? So if you have trained since the age of 3, all the way up to 25 for something to be able to produce something in 2 minutes, and you think that you should be able to just do it for free, no one else does that but you. Think about it. And they're like, oh wow, like you have a skill. You should be compensated for that. And I'm not saying that we should be millionaires overnight, but it's to start the seed of conversation of what is your body worth? What is this skill worth? What is this talent worth?
Mm-hmm.
How much, how can you now start thinking of ways to be compensated for your time, for your artistry, for your skill, so that you can start making better decisions and actually have a better life for yourselves. A lot of the reasons why artists make the decisions that they do is because they're financially compelled to. There's a reason for that. Yeah. We don't get paid a lot, so we don't go to the doctor because we can't afford it. Yeah. You know what I mean? We smoke because we're stressed all the time because we're in New York with 5 other roommates just to make the rent to try and get that one spot on Broadway. That's a fact. You know what I mean? So how do we break out of this cycle of just being consistently undervalued? We have to start valuing ourselves more. It starts with us, and then it goes from there.
Yeah. I like what you have to say. I think
I could go on forever.
I think it's great. But what I would like to talk to you about, since I see that we've got April here and Daniela, and April is, and Samantha. Hi, Samantha. So these are three of my beautiful company members, and each of them has very different backgrounds. Daniela, as I mentioned, is a nurse as well as a dancer. April comes with a very different set of, like her background is she was a professional dancer, a ballerina, has had some injuries, which were definitely career, I don't want to say threatening, right? Maybe.
Okay.
Not ending because you still, I mean.
No, I consider myself pretty lucky that at 41 now, I'm still going.
That's awesome. That's awesome.
So, but yeah, definitely just like you're speaking about injuries that are not really being taken seriously by my doctors, or they're just limited on, there's a lot of the steps that they have to follow as far as requirements for insurance and all of that kind of stuff that ends up getting in the way of my treatment. And so it's been quite a number of years that I've been dealing with my hip and my spine with no clear path to making it better necessarily. So I've chased things around on my own and had some relief in certain areas, but now I'm having things pop up in different areas. And it's interesting that it's all on one side of my body. Yep. So that's my that's my body story right now.
Got it. Did you have a specific question for me regarding that, or did you want me to talk just about general about?
Well, yeah, I mean, right now I'm dealing with, in particular, my neck and the upper vertebrae. I'm finding that anytime I compress the left side, I'll get a spasm that really starts to, it almost feels like something has slipped out of place. But once I kind of, hold and support and allow the spasm to release, I feel stiff but okay again. And I've just been the past even couple of days, I've had a couple of episodes where the moment I kind of let this release and compress the side, I get that spasm, and it's like, it makes me feel nauseous. So
that fun stuff. Yeah.
Yeah. So I'm not sure. I mean, I'm trying to like be good when I move about supporting my center, like keeping my pelvic floor engaged, keeping myself with space and elongated, and then just kind of limiting that movement. But the moment I try to like move to do anything, there it goes. I was even hugging my son the other day with my shoulder up, and it just hit me hard. So
Yeah.
I'm not sure. And again, because of like the insurance stuff, when I've gone for my lower back situations on the same side, they'll only baby step to actually look at my spine. So I've had 3 MRIs for my hip and lower back, and they won't look that tick further and that tick further to actually get a full picture of what's going on. So so anyway, yeah.
So this is the reason why I started my clinic, to be honest. I worked in an insurance-based model, several clinics for a while before I jumped and started my clinic. When you work in the insurance models, you as a clinician, and this is something that patients are not usually aware of, but as a clinician, it creates a double-edged sword. With insurance, you have a lot more patients that have access to you. But in order for us to see those patients, we have a lot of boxes that we need to check. I think Danelle will probably attest to this. We have a myriad of paperwork that we have to go through just to be able to even say, all right, April, let me just get my hands on you and figure out what the hell is going on, right? Depending on the insurance setting or the insurance type that you have and your doctor's prescriptions, and also depending on the clinic, clinicians will only go by what the doctor has written, because if they go outside of that, they will not be reimbursed for it. They will not be paid for it. It's all the game of like, does the insurance say it's okay, then we can do it. And 9 times out of 10, they're not saying that you can do it because they don't want to pay for it. I am so sorry. Momento. I have no idea how to turn this off. Maybe if I just do that. Nope. Still going. 1 second. There we go. I'm sorry. Are you guys still there? Still there, guys?
Yeah, we're here.
I'm trying to. There we go. I've had to minimize the screen. Okay, I'm back. Sorry about that. So with insurance companies, because they are the ones that are always kind of dictating what our standard of care should be, or if we have a standard of care, clinicians are always, our backs are against the wall. We're like, we want to be paid, but we want to help you. So we have to juggle these 2 things consistently. So that's probably why you got the care that you did. In terms of how I operate in my clinic, and as much as possible, I encourage dancers, and I know there's definitely a financial concern with it. I don't work with insurances. I'm an out-of-network provider, and that allows me the freedom to see as long as I want it for whatever I want. The conversation is between both of us, and we don't have to talk about the insurance. So if you have a hip and a neck and a back and a knee and an elbow, if that's what you want to work on, that's what we work on. That's as far as I can go. In terms of your neck, without looking at you, generally when you start getting spasms with motion, it's talking to some sort of instability issue. So you're going in the right direction in terms of releasing, but you need to stabilize that neck. That's what it's screaming out to me based on what you said. So try some neck stability exercises. You can get very general in terms of like doing chin tucks. You've probably done that before. You can do the resistance. Start getting into that range. So if about 45 degrees, you start feeling that it's starting to talk to you, go a little bit shy of that, stabilize there.
Okay.
Start seeing that it's going to be able to open up. You can turn all the way. All right. So try that out and see what happens.
Okay. Thank you.
Slow, stabilize in neutral, and then start stabilizing with a little bit of motion, and then start loading it up. Your neck needs stability. The reason why you're feeling nauseous is if those muscles in the back of your neck starts getting compressed, you start really compressing some very essential nerves up there. That is tied to all of your parasympathetic and sympathetic system, which is where the nausea comes in. So take care of it now. That's what I would say.
Yeah, thank you.
It does get more exciting. So take care of it now.
That's a good point to lead into. One of the things that I had a question about was just more in general was, age related injuries. Cause I deal with adult dancers, and I can't say that there are certain things that I see over and over again, and I don't know whether it's due to training problems or whether it's, so like I was just going to ask you, what do you see in your practice, like with typical age, like as dancers age, like whether they're professionals or whether they're just like, yeah.
So the oldest dancers that I do see actually are in the professional arena. So they're usually pretty well oiled, so to speak. They move pretty well. Their technique is on point. Usually what happens doesn't change over time though. Usually if there's a long-standing issue with an older dancer, professional or not, there is an injury that was never resolved that's now feeding into the technique, or there's a technique issue that's now limiting their ability to achieve the range that they have, that's now causing them pain as they increase their exposure. How many times that they're dancing, specifically with the professional people. So it's a little bit of a chicken and egg situation. And sometimes as they get older, depending on just how much history's been there, how much they've been training, or how long that injury has been sitting there, it's difficult to tell which one comes first. But those two things definitely play into each other. If there's an injury, you're going to have accommodation if it's not treated. So let's take April as an example. April has already told us in 5 minutes that, she's limiting her motion. Okay, limited joints and the body's designed to move. You limit things over time, you start losing your ability to perform that motion. So if we extrapolate that to a dancer, let's say grand battement to the side, every time they go past 90 degrees, they get that weird click in their hip and it hurts, they're going to start limiting. After a while, you're going to lose your ability and your strength and able to get that leg all the way up. Yeah, so it starts feeding one thing into the other. So it's difficult to say that there's one spectrum of injuries that older dancers get, because I don't quite see those again unless they're on a professional standard, but the pattern of connection is the same. If there's an injury and they haven't taken care of it, there's going to be an accommodation that starts leading into technical issues. Or if there's an unresolved technical issue, which I see actually a lot more often in the professional arena, it leads to bad injuries happening.
Do you ever work with like an instructor, with somebody, like if for instance I brought you April, let's just keep using April as an example. If I brought you April and I said, okay, how can we do this so that we're giving her the proper, like you're giving her, PT exercises to, like, you're diagnosing what the problem is, and then I in the studio can help modify her technique so that it, will fulfill the requirements that you're looking for from a doctor, So
yeah.
Do you do that? How could I do that? Like, is that something that I could, should be doing?
Absolutely. Interestingly enough, I do this more with professional dance companies than I do with studios. All right. You guys in the dance world, you know this, so you're not going to get upset. But dance studios tend to get very insular about, this is my technique and this is my style, and no one can come out because I am the person that says everything. We get very much into that world. So I tend to leave the door open, so to speak. If a student comes in, usually it's a younger student, they're not able to really verbalize what's going on. They're usually afraid of their teacher. They don't want to be ostracized for having an injury. What I would do is I'd be an advocate for that patient. And I was like, listen, this is what needs to happen. Let me call your dance teacher and tell them what's going on. 9 times out of 10, they're very receptive to it. I would say, again, if you're using April. So April has a pain on the left side of her neck when she does rotation. Maybe she should be just cautious with calm breeze when she goes to the left. Just pay attention. She can do everything else. These are her limitations. These are the things I want her to stay away from. 2 weeks, we revisit it as she's getting better. We can start incorporating that, but you want to keep an eye on her to make sure that she's not in pain or she's not injuring herself. Is that okay? Do you have any questions? And if they have questions, we have a conversation. Usually that goes really fine. Okay.
It's so great for children to have this kind of like advocate, because they just don't. I mean, I've taught all over Los Angeles, and they just don't have it. And in some of the most like, you know, prestigious schools in Los Angeles that you would think would have such great knowledge and information, they are so interested in results from these children. They are not at all interested in setting them up for future success, not even as a dancer, but also just as a human, like moving forward. It's really amazing. So having someone that in your position to say, here's what we need to do is so important. It's so important.
Yes. But I also recognize my limitations. Again, not all schools are open to this. All teachers are not open to this. And again, we also have to recognize the pressures of ballet, you know, the psychosocial aspect of I'm injured and I have to tell my teacher, oh my God, what is she gonna think? You know what I mean? Or I have to tell all of my friends that I have to sit this out and I have to miss the nutcracker. Oh my God, what am I gonna do? It's a huge pressure on them. So I would say for every 70% of every 7 students that I'm successful with, there's other 3% that are not successful. They would rather hide it, or the teachers are not receptive to it because they're just like, well, because now they're in a rock and a hard place. They want to push the kids, and depending on their teaching style, I know a lot of great teachers, but unfortunately I know a lot of shitty teachers. And I say that frankly, you know, like I've had reports of teachers shaming a student for not dancing because she had a stress fracture in her spine and didn't want to do a combre. And I'm just like, really? Like, the student eventually transferred to another school, so problem solved. But teachers like this exist. And this is a real thing for an adolescent teen who is trying to fit in, going through body changes, and has not reached their voice where they feel that they can oppose a teacher, which most people feel that they can't, you know? So I feel strongly about that, about really protecting that population and being an advocate for them. Where I do a lot more of my work is with professional dance companies when they do performances, professional performances, and they're going through town. Those guys need a little bit of a different tweak of work because their artistic directors will listen, because if a dancer's out, the show is done. So they get it, you know? So I feel like I have a lot more success with them on that level, because if a dancer for some reason cannot perform and the show can't go on, and I mean, you have a fixed cast if you're going from city to city moving around. And I had this experience as recently as January. Who was I working? I was working with, sorry, it's Friday, my brain is freezing. Alvin Ailey. I was working with Alvin Ailey, you know, and I was working with their dancers, and I'm like, oh, this will be easy. I'll be in and out, then I could go to the clinic, then I could go to sleep. No, second day, key dancers out. And the craziness that happens backstage is unimaginable, because it's the beginning of a tour. They have 11 weeks ahead of them, and they need to know if she can go on stage now. And I'm like, give me 5 minutes, let me figure this out. Okay? So even when things calm down, I mean, a lot of it is emotional also. You get an injury on stage, it's just like, it's heartbreaking. You know, you have your friends in the audience, family comes over to come see you perform. You know, there's celebrities coming to see them perform. It's very it's a high pressure situation. So in those situations, artistic directors, rehearsal directors are really invested in being like, what do we need to get this better? And they are way more receptive and open because there's so much more at stake. In schools, teachers don't quite have that investment, because there's always someone else that they can probably replace the student with. So they're just kind of like, oh, well, you're injured, I'll find somebody else. You know what I mean? So that's kind of how it goes.
It's so short-sighted. It's so short-sighted. The way I look at, the way I'm approaching dance, and the way like our company is focused is like about the idea of ballet for everyone. My company is anybody from like 18 is my youngest to 70 something, right? So I've got dancers in their 70s who are dancing like 40s, 50s, whatever. And I want them to continue. The goal is to dance forever. I don't want to just burn them out when they're, you know, like young people, because, you know, we want to dance forever. I think it's so short-sighted to not take care of this, like take care of things and work together. Like if I had a resource like you, I would absolutely be wanting to know, like, well, how can I get, you know, Samantha and Danielle and April, you know, how can I get them, like, keep them going? I want to keep them healthy, you know?
Absolutely. And I think, and this is another running theory of mine, because I do feel that you have to have perspective. And a lot of us have the lens of what's in front of us, but it takes a little bit of work to kind of take, step out of your shoes and step into someone else's shoes. And what I've noticed over the years is that also depending on the style of ballet, mostly Russian is very guilty of this. Their methodology is usually what they've learned for a long time. It's very hard to tell a dance teacher who's learned a certain set of skills over years to suddenly unlearn it because it's not serving their students. Because they are great at teaching what they know, but dance teachers are not usually very versed in problem solving. Okay, so I teach you how to do a developer. You go into your retiré, you go to your arabesque, and then you extend. If 3 dancers out of 20 don't get it, then something's wrong with them because the rest of them got it. You see what I'm saying? And again, they've had their experience that's reinforced that, 15 years of teaching, all of the students have got it. If you didn't get it, then it's your problem. And that reinforces, all of the negative attitudes that a lot of adolescents get. So dance teachers, in my opinion, when someone comes and says, my dance teacher, she's so mean, I'm just like, she probably didn't have a good experience. You know what I mean? Specifically when it surrounds injuries. She was probably injured and didn't have anyone support her, so she doesn't know how to support you. It's not that she, do you know what I mean?
I find a lot of teachers end up at some point deciding to stop being students anymore. And even my own, some of my own colleagues, that are in their 30s and 40s, and now they've stopped being professionals, or they're moving on in their later half of their careers and then moving on to teaching. Some of them, are starting to develop a mindset of that they're done, that they're finished. And it's so interesting. And then I have other teachers that, people that I take from that are still in their 60s and plus, that were professional dancers, and they're still students. And, they're still going out, they might not do classical ballet anymore, but they're moved on to all sorts of other forms of movement that they then incorporate and think about when they're giving their ballet classes. And the difference is really striking. It's really, really striking. And especially in this format, it's really striking because I've gotten to take a couple of classes in this way. And it's interesting, the people that are continuing to be students and thinking about these things, they have so much more to offer in this limited space than the people that have kind of said, okay, well, I've done it, and so now I know it, and I can just regurgitate what I have done. And you have nothing more to offer when all of a sudden our huge dance room is now shrunk down to this little screen. It's really interesting. It's
so fascinating that you bring that up. Here's why. In my webinar today, when we were talking about telehealth, clinicians are experiencing the same thing. I had this big clinic. I had all of these tools and all of these things, and now all I have is a screen. How am I supposed to get a change? How am I supposed to effect change? And I told them, I'm like, listen, this is going to test your communication skills. If you cannot communicate and you cannot problem solve, you will struggle. This is going to separate the advanced clinicians from the ones who are just like, just do 3 sets of 10. It's the same thing for dancers. It's the same thing for teachers. If you are not able to use this form and to be able to see that, April has her shoulder a little bit back, and that's why, her écarté line doesn't, okay, April, take your right shoulder, turn it forward a bit. You have to be able to be observant and to pay attention. This is all skills. And if you're a teacher that was just going through the motions, you're going to miss it. You're going to miss it. And I really do think that after this is all said and done and COVID-19 is over, please, Jesus, I hope you're hearing me, that it's over, and that a lot of students are going to be like, yeah, she's a crappy teacher. I want somebody else. Because now they've seen that's the beauty of what's happening online now. They're getting exposed to different things. And I tell my students all the time, you're paying these people. I know that you're afraid of them, but if you're not getting the instruction that you need to ask your teachers to level up or find somebody that will. I tell them that all the time. This is one teacher in one school. If you want to become a professional, you have to be able to accumulate multitude of skills that rarely comes from one person. If you're not
and I really wish parents would educate themselves more. I think,
yeah.
you know,
Yeah.
I had some good teachers and some bad teachers, but for the most part, you know, my parents, when I was younger, they kind of just let me go off and
That's
do my own
yeah.
thing.
Yeah.
And they didn't really help facilitate the information that I needed at that young of an age. And it took so long in my life then to get to the place where I was present enough to find people that had real solid information and a background that I appreciated. It's so difficult for children because sometimes they're just, you know, their parents just trust and they don't know where to go for the information. So it's nice to see people like you, like speaking out and being an advocate and, you know, putting that out there, because parents will look, but it's like having enough good stuff, you know, out there. It's hard. So
it is hard. And I realized in my ballet training, I didn't realize how amazing my teachers were until I left. There's some of them that I straight hated. I'm like, Lord, if this lady can make me do this combination one more time, I'm gonna kill her, you know. But I realize now how blessed I was. I really had teachers who paid attention, you know, and I mean paid attention to everything. Sometimes we were just like, damn, we can't get away with this in this class, you know, like, but they really paid attention. They were amazing teachers. And my assumption, you know, as I furthered my dance career and I got into physical therapy, was that everyone had the experience that I did. So when, you know, students are coming into my clinic and they're telling me these stories, I'm like, what the hell is going on? Like, it never crossed my mind that this was a thing, like people got something other than what I had experienced. You know what I mean? Leigh, the fact that you're leading this group says volumes about you as a teacher. I've never seen you perform. I've never seen any of your students. And I know you're a good teacher for this. That's a fact. Because
you're absolutely right.
Expand your knowledge and you're trying to give your students a better experience every single day. It's exactly that, you know. So, and we need more teachers like you to really push this movement forward, to have dancers be a little bit more assertive in the type of care that they're getting, to have dancers be more assertive in the type of training that they're getting, and to be more decisive about where they want their careers to go, and not just be like, well, I had a bad teacher and I had an injury, so I guess I'm just gonna sit at the front desk now. I can't dance anymore. Yeah. It shouldn't be an option. There are options for all of these athletes. There's a zillion options. There should be the same for us. Yeah. And especially on the training side also. I feel strongly about that.
Well, one of the things that what I love and appreciate about a physical therapist and is the body knowledge, the body awareness, because so often what I see so much anxiety in dancers, especially adult dancers. It's like, well, I just can't do that. I'm, you know, like either they were told when they were younger, oh, well, you can't do that. You're not going to be able to, you know, you're never going to do. I was told I'd never be able to do. You'll never do more than a triple pirouette. Okay. All right. So like, why would you say that, you know? So, but it's like, I always want what I think that is like, just like you're saying about like a dancer's body is like, is there is a toolbox, like there's a toolbox. And I feel like the more you can put into your toolbox, the more resources you have to fix the little things. Because dance and ballet especially is all about the little adjustments that you make, kind of like with physical therapy, all these little adjustments. And if you can look at it as you just need more tools, you need your more resources in your toolbox, then when you have a problem, you have a place to go instead of just throwing up in your hands and saying, well, I guess I just can't turn. I just can't turn. You know, it's like, no, look at it like an athlete. How do you fix that? How do you train? How do you retool? So that's what I look at, like somebody like what you're doing is you're saying, all right, here's your body. Let's make this work better with it, you know, like, and that's what I want my dancers to do too.
No, I think it's absolutely essential. Every problem has a solution. Every problem has a solution.
Yes.
If you consistently turn on your left and you do one turn, hop, 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 but you do 3 on the right, there's a reason for that. If you can do it on the right, you can do it on the left. If you can do it on the right 3 times, you can do it on the right 5 times. It's all science. There's no miracle. There's no, well, she was blessed with that and she's great at turns, but no, I'm great at presentation. That's not a thing. You can train your body. It's as simple as that.
Yeah.
It's as simple as that. It's a matter of cutting down and looking at the problem and looking at the common denominator that's causing your problem, fixing that, plugging it back into your technique. It's as simple as that.
Absolutely. I 100% agree with that. I totally agree with that. And it's like, so look at all of you dancers. You heard her. You heard what she said. So there's no reason why I can't see.
They're like, damn, we gotta work harder now.
I know. The thing that I like about Leigh, though, is she realizes that there's more to the movement than just the ending result of, what the movement is, that there's more to how you're moving your body and the presentation of it. Like, and when we rehearse and stuff, you can see that definitely in her class. But yeah, I appreciate that when, yes, you're right, we can do these things even though we're older or injured or there's issues happening. Like, you can make the changes and you can better yourself and all of those things. But then there's also more richness to movement than just the turn or just the leg going up. There's all sorts of nuance that there is there to be worked on, which is great. Like, that's part of what I enjoy so much about Leigh's classes and her rehearsing with her and stuff also. So yeah.
Awesome. Yeah. So Samantha, do you have any questions? Samantha's really quiet.
Ray joined us. Hi, Ray.
Sorry.
Sorry, I'm talking a lot. Oh, sorry, go ahead.
No, I'm glad to hear. I love, I mean, I don't know about Danelle, whether she likes all the, I love hearing what you guys have to say.
I love this. I love this. Samantha, give me a question. What are your thoughts?
Let me think. Are there any common, I guess, maybe parts of the body or exercises that might be overlooked that could lead to, I don't know, either maybe injury over time or weakness, or anything that you might recommend dancers pay more attention to?
70% of injuries with dancers are going to happen at the foot and ankle. Okay, we use our foot and ankles all the time, specifically if you're doing point work as a female. A lot of our injuries also are overwhelmingly overuse injuries, meaning that we use the same body part in the same way over and over again. Not traumatic, meaning you tripped on something and you fell, not that. But if you do a repetition over time and you do the same thing over and over again, those muscles get worn, the joint mechanics change, and then you start getting into overuse injuries. So you'll get a lot of the itis, what I like to call the itis. So itis in medical terms means inflammation. So you'll get the tendonitis or the arthritis. There's always some sort of inflammatory process going on because of that consistent overuse over time. In terms of exercises, there aren't particular exercises. I think there needs to be a change, and this is something I'm also going to go off on a little bit of a tangent on because I'm passionate about it. There needs to be a change, in my opinion, on how dancers approach their craft. And by that, I mean a lot of dancers will hear, oh, you want to do 3 turns, then you have to train more. Okay, we've all heard this. You need to be in class more. You need to do more class. You need to work harder. Okay, and that comes back to, in my opinion, that dance teachers and instructors usually have been trained in manipulating one variable to get a better result, which is frequency. Okay, if you go back to training and how muscles respond, there's several variables that can increase how fast you get a result. You have frequency, you have resistance, you have speed, you have tension. There's so many other things that you can use in order to get the performance of a muscle at its best. Does that make sense? Okay.
Yeah.
So for example, if I ask you to do 15 relevés on your right leg in an hour versus 15 relevés in a minute, those are 2 different muscle performances, correct? Makes sense? So time and frequency and manipulating it in that sense is a very different way of stressing muscles than just, doing it. So I say all of that to say that I think a way that we can really start changing and improving how fast we get the results that we do, along with protecting our bodies from injury, is by cross training. I shout it to the winds to my dancers all the time, and they're like, oh, we gotta work more. No, you have to work smarter. Yes. Okay.
Yeah.
Cross training, from my perspective, is using another type of movement that would accentuate your strength, your mobility, your stability in your original sport. So you want to be stronger in, let's say, in your aerobic capacity. Let's say after having Miss Leigh is working you and you're like, Lord, how long is this class? It's half an hour. I'm dying. I'm out of breath all the time. You need to increase your cardiovascular endurance. So instead of just doing more class, you do a sport that's going to really stress your cardiovascular endurance. One of my favorites, swimming, believe it or not. For you, water is resistance, and having to breathe through the water really stresses your cardiovascular endurance, so that when you get back on land, you're going to sail through class. Okay. And now this is something that is relatively taboo in the dance world. But when you start talking to professional dancers, this is all that they do. It's one of those things that we know is there, but it's not utilized in lower level training. It's only only professional dancers use this. So if you follow any of the professional dancers, I don't know, Misty Copeland or Tyler Peck or any one of them, and you look through their training program, they are cross training all the time. They are not just in class doing a million tondus, because they got to perform and they got to go on stage and they got to go on tour. So they can't get that repetition over time to wear their joints down. They need to be able to increase the performance of those muscles really well, and they are cross training, right?
Swimming. Yeah, that sounds like a good idea. It's low impact, but cardio, a lot of cardio benefit.
There you go. Low impact on the joints, very kind of the joints. You're really stressing the cardiovascular. You're getting your arm workout. So when we have all these nice little limpy arms that hang out, that start going like this when we're tired, sure, yeah, you're getting your arms to get engaged. Yeah, so it's such a good cardiovascular workout. It's one of my favorites. You would find in general that a lot of dance teachers are, specifically if they're very strict in the ballet world, are not a fan of this. But every single time in my experience that a dancer goes away and cross trains and comes back, they're like, what have you been doing? Every single time. I had a dancer, he had an injury, he came to me for a while, we worked on his ankle, and then for summer he was tired. He was like, I'm not gonna dance. I'm like, are you sure? He's like, I don't wanna dance. And he's like, I'm just gonna play soccer. And I'm like, oh, okay. He's about 16. I was like, this is gonna be interesting. Let's see what happens in fall. He went back to class in fall. Had he lost a little bit of technique? Sure. If you run around in a soccer field all summer, you will. But he ran loops around all of the boys. Because do you know how long a soccer field is? He was running and training all day, every day. You know what I mean? His cardio was here. And his dance teacher was like, what were you doing again? So imagine that. He trained his cardio up to here. So let's say he was at a 90% max in terms of what he needed to do in ballet. So all that immediately brought up everything else in his technique, his stamina, his strength, his adagio became like that because he had been training that all the time. I call it the multivitamin of dance, cross training. You take your multivitamin, you're like, ooh, I feel like great. So like that, it elevates every single other thing that you need to do. And most importantly, it protects your joints from overuse injuries. So that's what I would recommend. That was a long-winded way of answering your question.
No,
that's good.
Because that was one of my original questions. Like, we've heard a lot of cross training, and I was going to ask you what you recommended. And that's something that, it's like, I know Daniela does running, and I recently started to do some just because I'm cooped up in my apartment. But, I know that running, especially on concrete, is so bad for our joints, our knees. But swimming definitely sounds like a good option, and you get the same cardio benefits.
Absolutely. If you're not a big fan of running, you can do non-weight bearing non-impact stuff. Elliptical is a great idea. Biking, spin class is a great idea. That way you're not getting the pounding. Yeah. Okay, but you're still really working on your cardiovascular endurance. There's so many different ways that you can do it. And I feel so strongly about this. I've actually been working on an online dance course that I'm going to be launching shortly. Yeah, I love cross training, guys. It's my thing. I love it. I love it. So I'm gonna be launching that soon, and it's a 30-minute in and out. I don't like long exercises, so that's definitely my bias. I want to get you stronger in and out, so you can be like, oh, my leg is just okay. There's 30 more degrees. I didn't know I had that. It was there all the time. You just need that extra vitamin, you know. So I'm working on that. I'll let you guys know when it's
Yeah, that's fantastic. You have to let us know.
yeah.
What I see Ray is here, and I don't know if Daniela has anything to say. Hi, Ray. Ray is one of my dancers. I've known her for a while, and she's in my company too. Um, and Ray has come back from so many different injuries.
Nice.
So knees and feet and all kinds of things. And she dances on point, so she's pretty
Oh, awesome.
fantastic.
Awesome.
Yeah.
Ray, do you have any questions for me?
Yeah, I'm a senior citizen. And I'm concerned about breaking bones. So I want weight-bearing exercises, I think, to make my bones strong, right?
Definitely. If you don't mind, how old are you?
76.
Oh, what? Dang, I love this. This is what my dancers need to see. You know what my dancers tell me? They're like, well, like I have to perform and I have to do that audition. I'm like, why? What's the rush? Well, I'm gonna be 30 soon. I'm like, what? Who told you you can stop dancing at 30? Well, that's when everything goes. They need to see your face, Ray. They need to see you. That's amazing. I love that. All right. So osteoporosis is definitely a concern as you get older, right?
Yeah,
And
I'll fall and break something.
I'm sorry.
I'm afraid I'll fall and break something, like fall off point, you know?
Yeah, that is definitely a concern. Here's the thing: the more that you increase your aerobic capacity and your strength, the less of a chance you are that you're going to fall. That's a fact. I would say that if I had to put you up against someone that is equal to your age that does not dance, your balance, your proprioception, your ability to tell where you are in space without looking down, and your general orientation is going to be way better than others. That's a fact. That's just one of the beautiful side effects of being a dancer. What in terms of being concerned about that, you do the usual stuff. You take precautions. Make sure if you're wearing point shoes, you have a little bit of rosin, the floor is not too slippery. You do those environmental checks to make sure that you're in a safe environment. But for you, I think it's even more important to do weight-bearing exercises. For you, I would recommend maybe walk, jog intervals on a treadmill would be a great option for you. So you're not getting a lot of the impact that may bother your hips or your knees. But you definitely are still able to get some sort of weight bearing through those bones, that those bones need that feedback to stay strong. And I think some low level strength training would be amazing for you. Okay? Not heavy weights, we're not trying to bulk up, but your muscles need more strength and more girth. And the way that you make sure that you stabilize and you bulletproof, so to speak, that stability that you're lacking, if you are lacking, is to strengthen your muscles more. And the fastest way to do that is in a loaded position with some resistance.
Yeah, okay, that's good news.
Yeah, awesome. All right, Daniela, did you have any questions for me?
Yeah, if I can ask my question, I have my own injury to share.
Sure.
So about 2 years ago, I was running like around the time our company was like in the middle of all their stuff. I was running like crazy and dancing like crazy, and I pulled my calf.
Mm-hmm.
So I pulled my calf, and it just became like a chronic thing. I got back, and then I stopped running. I stopped dancing, let it heal, saw physical therapy, and about probably a good year ago is when I started cross training more rigorously. So it has gotten much better. And the goal was to strengthen all my big muscles to take the load off the calf. And I did just a lot of cross training. And it got way, way better. The idea was that my goal was to make sure I could withstand all of the extra weight I would accidentally put on the calf if I accidentally slipped up on technique and ended up stressing the calf on a jump or something. So just to kind of build, like you were saying, build up the muscles so that it can take the higher load. And it's doing great. But after our last season of our rehearsals and shows, we were rehearsing like all weekend. I started noticing pain in my heel getting worse, like right where the tendons insert. And
Same,
that is,
same leg,
I'm sorry?
same leg.
Yeah, the same leg. The
Got it.
same leg. And that's just been kind of like a chronic thing. We wrapped up in October and it would go away. It lessens but never goes away. I think probably now it's like the best it's been because I have been pregnant and sick and off my feet a lot, and we haven't been in the studio as much, so it's given me time to rest. But I do notice it'll still aggravate. It's just like a chronic thing. I think when I saw PT, they were telling me more like, think of it as tendinitis. I don't know if it's like a plantar fasciitis and tendinitis, but it won't go away. And I feel that you can feel the tendon, you can hear it if I roll it, or even sometimes if I just flex my foot and do this, you can hear from like the bone grinding on the tendon, that like the inflammation, I can feel it clicking. Yeah, it's my angry foot.
Oh, not good. Sounds like you have, well, there are two things. It sounds like you have and resolved the calf strain. It seems like it got better, but you didn't completely go through your rehab. If you go through completely your rehab, you should be able to do all of your full activities without having any issues. And if you were still trying to find ways to strengthen sole to protect the calf so if you landed on it, you could tolerate it, it means that you weren't able to eccentrically, what we call eccentric loading. So eccentric loading basically is, there are a couple of different contractions that a muscle can do. If I'm thinking of my what's this, my biceps, if I flex and I made a muscle that's concentric, you're shortening the muscle. Eccentric was if I would have a load and I would slowly lengthen it out. So it's contracting, but it's lengthening. So when you're landing from a jump, you're doing a lot of eccentric loading on a calf. That's the hardest sort of contraction that a muscle can do. So if you were still tentative in terms of your jumps, it means you didn't complete your rehab. So it was just kind of hanging out there. And for dancers, you need to do that. Like, you're eccentrically loading your calves in just about everything you do, either very slowly with a grand plie or a demi plie, or very quickly with a jump. You go through that motion all the time. Does that make sense? So if that was not resolved, at some point it would start working its way either down the chain, which is where it has for you in terms of getting into your foot, because then those fascia does attach to your calf muscle, or it would start going up the chain in terms of to your knee and your hip, which is a whole other sort of exciting thing that's going on. In terms of addressing that, it seems like the more acute thing right now is to address your foot pain. And there are a couple of simple things that you can do. It sounds like it's a lot more acute right now, though. Am I right?
Right now, it's
a lot painful.
It's not as painful as it is when I'm constantly on point, like repetitively using it. And the jumps feel fine, but it's usually with point work whenever I'm using like my foot and my calf the most.
Got it. So I would start from the bottom up. You want to address your acute pain symptoms right now. Get you walking without pain, squatting without pain, going up and down stairs, going onto your elevate without pain, and then you start working to the higher level activities. It seems that you need to resolve the plantar fascia issue first, and then work your way back up to the original injury, which is where the calf is. And if it didn't quite resolve, I'm wondering if it's actually a calf and not a deeper muscle. That's usually a very it's very easy for calf pain to be like, oh, well, it's my calf, but there are loads of muscles underneath that big calf muscle that can hide out. That's very difficult to get out.
It was one of the last diagnosis I got. It was one of the deep.
Was it posterior
posterior tibialis? Yeah, no, anterior tibialis. I think. Is that possible? Interior or posterior? Isn't it both?
Probably posterior.
Posterior. Okay.
One of the leg, and it 1%.
No, yeah. It like wraps, so it's the posterior, right? Because it inserts into the heel.
Yeah, so
not my area.
So that's a very typical injury, and it can be tricky to rehab. I'm happy to send you maybe a couple of exercises that may be helpful for you to start the process going. But I would advise, again, start with rehabbing the heel first and the bottom of the foot first. then you got to work your way up to that original injury. If you don't resolve that, this is going to come back again.
Yeah, it seems.
And unfortunately, does not help you.
I know the extra 20 pounds. No, and whatever else.
Well, outside of the extra 20 pounds, at some point you're going to have a lot of hormonal changes, which if you've not experienced already, so that extra, hormones in there, you're going to have a lot more ligamentous laxity going on. It gets more exciting. You're a lot more sedentary, because you're with the kids. So getting back, that journey back into getting to that activity and that, it's rough. So start slow, go and slow, fix the bottom of the foot, then work your way up. And then that's where I would go with that.
Okay, great. Thank you.
Of course.
Wow. Yeah, these great questions. Everybody's got these, different bodies. It's like that's amazing. I love that. Because as you're talking about things, I'm learning so much. It's like when you talked about the eccentric, I'm like, oh, that's interesting. I didn't even think about that. I'm thinking like just from a point of view, like you're, like with the muscles and everything, I'm thinking about the breath and like relaxing as we're rolling down so that you're not gripping everything. And it's just interesting to hear your like the way you're looking at a jump, like a landing, and I'm the way I'm looking at it. So it's really interesting. I love that. Love it because I think it's so complementary. You need both. You
need both, and depending on how you're trained, we all have different ways of approaching all of our technique things. So a lot of people use the breath to really actually activate your thought process on what muscles need to be engaged, or to give yourself a little bit more oxygen to think of engaging that muscle when you jump or when you land or when you're holding up into a pirouette. It's different, and it's all different skill sets. And you're right, they're all complementary. The mechanics don't change, but the way that you can approach it, you can come from so many different ways. So a lot of times when I'm working with my dancers, I don't get stuck on the way that they do things, because it's depending on how you're trained. Yeah. I do get stuck on the mechanics if that doesn't change.
Yeah, I love that. I love that it's a mechanical approach, because everything is just a problem. I love that. I agree, the same thing. Everything is a problem to be solved. Yeah. It's like, here's the problem. The hardest part for me is to figure out what the problem is. It's like sometimes it's like I think it's one thing from a technique point of view, and then but from a PT, from a doctor's point of view, you're thinking of it. It's like, oh no, it's something like I remember with like Daniela was mentioning those tiny muscles underneath the calf. And I didn't even realize how impactful those were on my ankle and foot until I had an itis, right? And a friend of mine said, oh, when you're wearing, because I used to wear to teach those, jazz shoes, right? Not jazz shoes, but like, like the split sole canvas, not canvas, but like, the block.
Yeah,
you know what I'm talking about.
A little bit of a heel.
Yeah, so a little bit of a heel. And she told me, oh, whenever you're working, you're never actually stretching your heel completely. It's always in a slightly contracted position. And so that had implications for the calf, all those little muscles under my big calf muscles. Like that constant contraction was pulling on those muscles. And I'm like, oh my gosh, as soon as I got rid of those shoes, that was like 10 years ago, I've never had the pain ever after that. And I was like, wow, it never even occurred to me. So it's like things like that I love to know, because it makes, has a huge impact.
Yeah.
So.
And I always encourage dancers to, being injured is difficult. I mean, if you are dancing and you've had an injury outside of the physical pain of whatever's going on, the mental stuff of having to figure out how to get around an injury is really tough for dancers. Very much so, more than other athletes, because again, as we talked about at the beginning, we don't quite have the setup in terms of help and support, and even knowledge base of our support system is so not prepared to help us when we're injured. Not to mention that we don't even talk about injuries, period. That's a whole other conversation. So I always tell my dancers when they get injured, I'm like, this is some time. I'm like, You're taking one step back to take 3 steps forward. This is a window, you have an opportunity. Once you learn more about your body, you know what to look for the next time around. And 9 times out of 10, if a dancer goes through rehab and they've gone through it, their approach to dancing changes, because now they're starting to understand, oh, this is an actual mechanical tool. There's a way that it works. You don't just produce movement. You're not a puppet. There's a way that the body works. And when they start understanding that concept more, their approach to training and their approach to technique and the choices that they make changes. You know, so I've had dancers come to me and say, this choreographer, he wanted me to do this. And I was like, yeah, I can't do that. And some choreographers asked me to do some crazy stuff, guys. I'm not like, I've heard some stories. I'm like, nothing in your brain said this was a bad idea. Like, really? You're just like, yeah, let's do it. Because, you know, and mostly young dancers, you know, they're very impressionable. They want to do anything. They're flattered that they get an opportunity and they have been chosen. So they're willing to throw themselves into it. Craziest story that I've heard was a dancer. She was actually in your side of town in California. And she had this choreographer who wanted her to do this kind of still piece on a beach. And she was in like ski boots on a beach. Don't ask me, I don't know. Full bodysuit and ski boots. And she's standing, I'm gonna stand up. She's standing and she has to do this motion where she's kind of leaning forward and back. But if you know ski boots, it immobilizes you from the ankle all the way up to the knee, okay? And she's the most bendy person I know. And I'd already had a nerve ablation. I'm not sure if you guys know what that is. Basically, they go in and they burn your nerves when you're constant pain and they can't find a fix for it. They just kind of like switch the lights off. They just burn the nerves. She'd already gone through that for her SI joint, which is the base of your pelvis. All right. And she's going through this motion and she's doing all of these wavy things. But if you are immobilized here, I can't do it. You're going to be really stretching forward and really stretching back. And she comes in and she's like, my hips, my back are killing me. I'm like, are you surprised? You stopped one part of your body from moving and then you bent like a tree in the wind. Wow. Something's giving, yeah. You know? So you once you start really going through injuries, you start being a way more critical thinker of how you're treating your body, which is so important. Mm-hmm. And it's something that I would not trade for the world. I would have not wanted to ever go through my injury, but it brought me to where I am speaking with you guys now. I understand how the body works and I understand how to help other people with their body issues. And it's knowledge that's irreplaceable. Yeah, so.
It is. And I think that, like you said, it's the psychological aspect of it as well, which is I have this injury now, I'm never going to dance again, or I'm never going to jump, or I'm never going, it's like you just go to that place instantly. It's like, yeah. This is it. This is the way my life is now.
Yeah. and it's so easy to be like, oh shit, like this is it. You know, or you know, my little crazy brain, this is how I die. This, you know, this is how I die, you know. But no, the more knowledge is power. It's so much power. If you understand it, like, oh yeah, my body's talking to me, you can catch it before it happens. Traumatic stuff, we can't anticipate that. That is what it is. But the other stuff, which again is almost 90% of injuries for dancers, is overuse injuries, that you can change. Yeah. That you can change. So it's all about getting the knowledge and getting the right people on your team. So
how far do you recommend going when you are trying to track down, just like you said, so the nerve situation that you were talking about was something that that I discussed with my doctors also, about options for the issue that I was having with my back, which they believe to be my SI joint. And I kind of stopped pursuing the route. I ended up having a steroid injection in my SI joint on the side where I was having the pain, and the pain was continuing constantly for a couple of years before I went in to have the injection. And I had a really bad reaction to the injection. I ended up having necrosis of the soft tissue because of the injection. Yeah. I don't think it was administered properly. I'm not sure that, you know, I liked the doctor. She's a good listener, but she was very linear in her thinking. So I don't know. So anyway, I'm getting off track, but so when you're having that constant pain, which there might not necessarily be a current injury, but your nerves are kind of on that train track of sending that message over and over again, how far do you recommend messing with the nerves? Do you know what I mean? Like, I'm trying to, for myself, gauge like where to go in dealing with the nerves, moving forward, trying to get relief from the pain, but then not necessarily shutting things off to where I'm not getting messages that I should be getting messages. Does that make sense? I don't know if that was a good question, but
yeah, it's very broad. I'm thinking of how to best answer you. I would say you need to chase what's causing the pain, not the pain. Those are two
right.
okay.
Right.
You've given me a lot of information.
I'm sorry. Yeah.
Oh, that's okay. When doctors are giving you steroid, let me walk this back. When you're seeking medical care, specifically as a dancer, I believe it's very important to figure out and understand your mechanism of injury and what's causing what and what's the solution and what it's going to give you. Okay.
Mm-hmm.
And I think this goes into a bigger question of how do you choose a medical provider that's right for you? Yeah.
Right.
All right. Seems like the doctor that you encountered, I'm pretty sure she's an amazing doctor, but the approach for dancers is very different to the general population. Okay. The fact of the matter is that you guys move in ways that the rest of the world does not move. Okay. So exactly what you said, a very linear approach is not probably going to be the best thing for you because you don't have a very linear problem.
Right.
Sense? Okay.
Mm-hmm.
With SI joints with dancers specifically, the problem usually is you have a stability issue. There's a reason why your nerves are like going crazy and they're like, this hurts, it hurts, it hurts. It gets worse and it gets worse. If it keeps getting irritated, it goes up to the lumbar spine. If it even gets more exciting, it goes down to the hip. And there's all sort of fun stuff that can evolve from that. Pelvic floor issues, knee issues, you name it, it's on the table, okay?
Mm-hmm.
It builds and builds and builds. If you don't get to the original problem that's causing that nerve pain, it will not go away. So for example, the dancer that I spoke about, she had the nerve ablation. Nobody looks at her pelvic floor. The doctors were just like, well, we tried PT, we did this. Let's just shut the damn thing off. And they shut it off and she was still having pain. Nothing changed because that wasn't the problem. So when you start looking at like injections, steroid injections, the purpose of a steroid injection is to shut pain down. Mm-hmm. Steroid is a medication. They're putting the medication right at that spot. It switches it off. Pain is a signal. It's your body telling you there's something wrong. It's not a problem. Do you understand what I'm saying?
Mm-hmm.
Different things. So you shutting off the signal doesn't mean the problem has gone away. You just switched the lights off. The current is still flowing. Does that make sense?
I think they were trying to, they're trying to track down where the issue is. And I think that was, it was after several MRIs with no clear picture. I didn't have any clear pinched nerves. There's no, at first they thought it was a labral tear. There's no tears, so they're trying to track down what the problem was, but there's not even any issues in the SI joint that they can tell. But so they're trying to track down, okay, well, what's causing the problem? But given that the injection made more trouble for me, it wasn't quite clear. But just what you're describing is really helpful because it is now becoming more traveling up my back. So it's interesting because the hip pain that I was having so consistently has dissipated, but now I'm having more of an off and on feelings happening in my back. So it is like traveling up, which then goes to the pelvic floor stuff also. So the stability deeper. And I've done a lot of physical therapy for the, muscles on the outside, but pelvic floor stability and that kind of physical therapy, from what I've heard, is much more specific, and you really have to see someone that knows what they're doing with that. So
yes, and yes.
Okay.
I will say a couple of things to add to that, April.
Mhm.
First things first, find a dance medicine professional.
Okay.
You guys are different. You guys are unicorns in the medical world. Accept it. It's a good thing. It's great. You got to find a unicorn doctor. I'm just going to put it out that there. Okay. Find someone who's familiar with your craft and they know what dances are about and they can use you. Okay. The second thing that I would do is to probably get a consult with a pelvic floor specialist. If you haven't cleared every single other part, it doesn't matter what's going on in the back because you don't know where it's coming from. So this is detective work, and we're getting a skilled clinician in critical decision making and getting you a very good differential diagnosis and narrowing down where your pain is coming from. That's going to be key to your intervention. So you're going to be chasing this for a while, and all the time that you're chasing it, it's just growing into a bigger and bigger problem.
Do you find that people that do go towards that pelvic floor specialty usually have a good amount? Physical therapists, which I found, have just such a wide range of specialty and knowledge. And I started with someone that was very much focused on just athletes in general, and they didn't have enough information for my specific body. They were very much like, oh, you can move your hip, great, you're fine, and then here's a bunch of exercises for your quadricep muscles. Meanwhile, my glutes on the side where I was having pain were completely shut off and not functioning at all. So when I did find a dance physical therapist, he was able to really pinpoint really the muscles that were not supporting. So with physical therapists wide range, the pelvic floor then kind of is a little bit daunting as a patient going to try to find someone because it's such an intimate area. And I worry how, when it's on the outside, I'll go see and try anybody. But when it's all this woman stuff on the inside, I'm a little bit nervous about starting this path and trying to find someone because I don't know how invasive it's going to be before I figure out, does this person know what they're doing?
Got it. So here's my recommendation. Well, first of all, with pelvic floor, it's dealing with stuff down there. It's not all internal. That's a good news. Okay. I do a little bit of pelvic floor stuff. I'm not hugely versed in it. If I see a patient with a true pelvic floor issue, like for example, pelvic floor prolapse or incontinence, I would refer them out. But if there's some sort of thing that's feeding in from pain from the hip or the back, I can treat it. And I don't do anything internal.
Okay.
So there's that hope there. What I would do is if you found a dance physical therapist, keep him very close. Don't let him go. Send him Christmas cookies. Don't let him go.
Totally.
Hold on to him.
Yeah.
And what you do is you find, and I can hook you up to a lot of amazing, I know it's very weird, but I know a lot of pelvic floor therapists. I can connect you with some pelvic floor therapists that they can work together and combine your knowledge to get you better. It's about your team. You don't need a unicorn, you need a good team. But you need a good team that fits you. So if you have your dance therapist, hold on to him. Find a pelvic floor physical therapist that works well with you, and they can combine their knowledge to get you moving. Hopefully your dance PT is someone who is okay with collaboration. He's fine with that.
He seems to be he's very open. So and I think he's trying to search for somebody for me that it's, money also comes into play because with insurances, you have to go see someone in particular, and that person's not necessarily experienced in the things that you need. So it's kind of quite a bit of a process, but speaking to you is great because it kind of lights a fire under my tush to no, I can solve this. It is possible.
You can solve it. And I would say, and this is from years of experience, I'm not saying that they're not great in network PTs. A lot of the ones that had experience and are great with patients are done with the insurance system and they're out of network.
I don't blame you.
So it may be worth your time to just be like, let me just fix this damn thing. Let me just get 3-4 good visits in, invest in it, and then you can move on with your life. And it seems like you've got a long journey with it. It's something to consider.
Yeah. Okay. Thank you.
Yeah, you're welcome. All right, guys. Any other questions?
You are amazing. I wish you were out here in Los Angeles. And we would
Hey.
we would put you on staff with our Leigh Purtill Ballet company, and I would put you on staff with my class. I would like really collaborate.
I can be your virtual consult, but I'm pretty sure I'm sure there are dance therapists out there. I'm pretty sure.
Yeah.
I have to do a little bit of looking. I'm not sure who's so much in the LA area, but I can be your guys' virtual dance PT. I'm happy to help you guys.
All right, we'll take it. Yeah. Thank you so much for your time. This is amazing. I'm really, really glad that thank you all for joining us today. This was kind of just like hey, we don't even know each other. Let's see how we can, get to know each other and sort of connect to the community. So it was a really great, I really enjoyed this so much. I love listening to you, and I'm wholeheartedly engaged in your philosophy.
Awesome. If you guys have more questions, shoot me a message. I'm always happy to answer your questions as much as I can, and give you additional guidance if I can. As I said, I can talk about this all day, every day. I'm very passionate about my profession. I got into it because I'm a dancer. I get it about the whole injury thing. I've been there. I get it. I know what it is. That's why I got into physical therapy. So it's a very true weak spot of mine to work with dancers. So I just enjoy it and love it so much. So always open to helping you guys any way I can.
Thank you. Thank you. Have a great day, the rest of your day. And thank you all for joining us.
Thanks so much.
Thank you so much.
Guys.
Thank you so much.
Yeah, now I know what to do.